Good afternoon. This is Damian David with Healthcare Triangle, and welcome back to Week in Review. This is week 19, August 20th, 2020. I'm going to do some headlines. Going to talk with a colleague of ours. Actually, not really a colleague of mine, somebody I get to work with, and it's a pleasure to. She's a great personality. She's been helping us out on a project, Ozarks Med Center. She's a CMIO over there, and she's an active hospitalist, Dr. Priscilla Frase. I'll hop over to a video call after I get through the headlines and the statistics. Fascinating stuff. She's got a couple of presentations coming up. One's at next week's MUSE InspireOnline. It's a 3-day program, if you will, of different sessions, webinars, great information. So definitely check that out. Check out the description. I got the links in there for you if you'd like to register for some of those presentations. Along with Dr. Frase from Ozarks Med Center, TJ Temple, CIO, he'll be presenting as well. So wanted to give those shout outs before we get going. After that, I'm going to leave you with a song. I don't know, it's my mom's birthday, so it's of her area. It's a request and throwback to the times in the 60s that kind of presented themselves in times today too. So a timeless song. Hopefully you enjoy it. A little bit of new take on it. Push the envelope, if you will, on it a little bit. So hopefully I don't lose anybody on it. But yeah, got a little bit of production going on with a colleague of mine, Isaac Palmer, played drums on it. So thanks, Isaac. Appreciate it, man. All right, without further ado, let's get to the headlines here. Next week, as I mentioned just moments ago, MUSE is having its virtual InspireOnline event. It's 3 days of excellent webinars, sessions, and programming. So again, I put the information and the details on how to register and sign up for that in the description down below. So hopefully you'll get a chance to check that out. Also, MEDITECH announced that its 2020 CIO and Physician Forum is going to be held online this year. So nobody's going to the Boston area for that, unfortunately. We'll have to keep in touch with you online for that event. But the programming there is coming together as well. Some great keynotes. Looks like I'll get into that a little bit more, and I'll wrap that as we get a little bit closer to the fall for that. Last week, one of our news headlines that I announced was that New Zealand, after 102 days of going COVID-19 free, had 4 cases. It was a family that came back from travel. So again, New Zealand is facing the COVID-19 pandemic. They decided to go into lockdown to prevent a resurge, but unfortunately in this past week, they've been able to find 65 new cases that all seem to be related to that one family though. So we'll keep our eyes on New Zealand and see if they have a surge in COVID-19 cases over the next couple of weeks, or if they're able to lock it down again. CDC Director Dr. Robert Redfield stated that we should see COVID-19 deaths start to drop across the U.S. by about next week, he's thinking. And that's thanks to different mitigation efforts like controlling crowds and closing different large gathering venues such as bars, etc. So we'll see if the efforts and the effects have led to better outcomes. Outbreaks at U.S. universities and colleges are forcing them to change plans. So a couple of universities and colleges, Michigan State, UNC Chapel Hill, and even Drexel, they're some of the leading universities, colleges that have decided to do 2020-2021 season in the year in education online. So they're not doing anything on campus or on site, very minimal at least. Most of their catalog and most of their courses and most of their classwork is going to be online this year. So that's already been noted. Cases of COVID-19 in Europe have surged this past week. So France, Germany, Italy, and Spain, they're all reporting rapid growing number of COVID-19 cases this week. In sports, this week's Mets Yankees, the Subway Series, if you will, in Major League Baseball, it's been canceled. Mets have had 2 cases of COVID-19 on the team reportedly this past week. So they're just going to cancel it just to keep everybody safe. The WHO, they're going to issue guidance fairly soon on masks for children and use of masks for children. So I think that will have an impact on education and how schools have been rolling out, having kids back in the classroom throughout the U.S. I know my kids in Nebraska, this is week 2 for them. So far, so good. They've been diligent. They've been really disciplined, and the teachers, the staff, professionals at the educational operations have really been impressive to me. So I hope it keeps going, and I hope they continue to stay diligent and safe. WHO also states that a vaccine, though it will be helpful, will most likely not itself end the pandemic on its own. Okay, so it's very important to note that it's going to take a lot of continued effort and diligence on our part too. So keep masking up, please. Thanks very much. I appreciate everybody's energy and efforts, again, towards your communities, towards each other. Let's stay safe. Let's stay diligent. Let's get to the stats this week, okay? So around the world, we're up to 22.6 million cases of COVID-19. Last week, we were just sitting at 20.08 million. So that's quite a substantial increase, almost 2.6 million more COVID-19 cases across the world, if you will. Of them, 14.5 million have recovered. Last week, only 12.2 had recovered. And then we were up to 792,000 deaths around the world from COVID-19. Seems to be slowing a little bit. Last week, we were just at 727,000. If we narrow that down to the U.S. stats, let's take a look. 5.6 million COVID-19 cases reported. That's the total in the U.S. Last week, we were just sitting at 5.11 million. And then this week, we don't have a tally of the number of recovered. We just didn't get the readings this year from a U.S. perspective. But last week, we were at 2.54 million recoveries across the U.S. Hopefully, that will continue to trend upward. Deaths in the U.S., we're sitting at 174,000 deaths in the United States from COVID-19. Last week, we're at 164,000 deaths. So that seems to be a little bit of a spike. I'd like to see that trend downward over the next week. Okay. So with that said, I don't want to take any more time from you. I had a fascinating conversation with Dr. Priscilla Frase from Ozarks Med Center. It was fun to talk to her. It's always great to catch up with her. So let me jump to that without further ado. Dr. Frase, great to see you. Thanks for joining me on the call. How are you doing?
I'm doing well today. Thank you.
Excellent. Well, hey, I heard that you're going to be doing some presentations. One's for MUSE next week, and then you'll also be doing a presentation just announced recently, MEDITECH CIO Physician Forum to be had in the fall, all online now, so not in Boston area. So I guess, I'm excited. Can you tell everybody, tell me a little bit about the story, how you got to where you are in dealing with EHRs and MEDITECH, and then also, tell us about what you're going to be presenting.
Okay. Well, I kind of got into doing what I do because I actually don't like electronic medical records. When I worked in residency, I happened to be at the VA hospital in my town where I trained. The very minute that they went from paper to electronic medical records, I had practically no training, and it was a horrendous experience. And once I got through that month, I refused to ever do anything again with electronic medical records. But as we all have experienced a few years out in practice, I couldn't avoid it anymore. So I kind of jumped on board, dove in head first, and became a physician educator for HCA and helped train physicians on CPOE. And somehow that eventually led to me getting a title of CMIO at the hospital I'm at now. So I've just kind of learned the hard way with it, trying to always find the best ways to make things work for providers and for myself.
The classic, if you can't beat them, join them, huh?
Exactly.
Great.
So, and what I'm going to be presenting about is actually problem list. One of the challenges that we face in our organization, and I know everybody does, is what to do about problem list governance and management. We have actually never had any governance around problem lists. A couple of years before we made the decision to go to live with Expanse, we had a policy that people had to add one diagnosis on problem lists, and that was as far as anything ever got. And that was just, we could meet meaningful use stage 2. And when we made the transition to Expanse, you could see how much thought MEDITECH had put into it to change problem list management from client server or Magic to what they envisioned in Expanse. And I didn't like problem lists either. It was this foreign concept that didn't have to do with anything that I was doing, or at least so I thought. And to try to come up with a governance plan, I really dove into a lot of the history around problem lists and where they came from, and was somewhat surprised to learn that they actually date back to the 1950s and 60s, well before electronic records were being actively used by anybody. And was able to learn that almost all medical records are actually based on what's a problem-oriented medical record format that developed on paper, primarily among family practice physicians. So I kind of took that and looked at what Expanse had to offer in terms of problem list management, and over the course of the year came up with our governance plan for problem lists. And we ended up not converting any problem list information into Expanse when we transitioned. And, it's not perfect, but we have been successful at engaging physicians in problem list management, and to have that thought process, what am I supposed to do now? And I actually have surgeons, and I have hospitalists, and I have primary care doctors, and even a couple of anesthesiologists who get involved to manage the problem list. Okay, anesthesia is stretching it a little bit, but they at least ask questions and want to know more about how we can make it more seamless within Expanse. And so my presentation with the MUSE conference next week, as well as at the MEDITECH Physician CIO conference, is going to delve into a little bit more about how we got people on board with problem list management, how our PAC team came up with our governance structure, and go over some examples of before and after problem lists, looking at the different, we had T-System, we had MEDITECH, and we had Allscripts. And so we had 3 different problem lists in each record, and I'll show sort of a difference between the problem lists and those and what they look like today in Expanse with real live patients, and what we continue to do with it.
I think it's going to be fascinating because it's a great look at a success story. Also, not only from the actually consolidation from those 3 systems into one, but also, just getting the users to buy into it and use it. So I think that's a great story. I'm excited to hear about it. So there's 2 opportunities to hear it, it sounds like. I'm going to leave the details about next week's MUSE in the description in the Week in Review. So to everybody, if you want to scroll down to the description, there'll be some links to the information. You find out more, find out the time, the agenda, etc. But yeah, I can't wait to see it. That's great. All right, I typically like to put people on the hot seat and ask silly questions at the end of these. Are you ready to be on the hot seat for me?
I guess I can do that.
All right. Well, again, before I get there, thanks so much again, Dr. Frase, for joining me. I appreciate your time. I'm looking forward to your presentations. And here we go. So the question for you is, if you could spend a half an hour with anybody throughout past history or during current times, who would it be and what would you do?
Oh, man. I've been asked that question before, and I always say Martin Luther King Jr. because I have the same birthday as him.
Really?
But with everything that I've been doing from the medical record standpoint and just a lot of stuff that's been going on in my own life lately, I would probably say Elizabeth Blackwell. She was the first female that was awarded a degree from a medical school in the United States, and she worked with a lot of other first females in the country, as well as with Florence Nightingale. She had a lot of things that she was passionate about that she tried to get pushed over or get accepted in society. She wasn't successful at a lot of it, and there's a lot of things I didn't agree with that she did, but I would have loved to meet the woman that managed to work her way into an all-male medical school with a unanimous vote by all the male physicians in that school, and just talk to her about that. So.
That's a great one. That would be, I think you'd probably need more than a half hour.
Yeah, it would be.
Yeah, that's a great answer. Thanks for that. Well, again, Dr. Frase, I'll let you get back to it. Really appreciate not just the work and effort you're doing around the problems list, but just specifically nowadays what you and your team are doing to help your community through COVID-19 coronavirus. Keep up the good work. Glad to hear you guys are being diligent and safe, and hopefully the outcomes keep you guys safe from here on out. So when travel opens up, I'll probably see you soon, all right?
Thank you very much. It's nice talking with you, Damien.
Special thanks again to Dr. Priscilla Frase. Thanks for joining me. Always a pleasure catching up with you. Hopefully we get to do it again soon in person. Hopefully one of these conferences and presentations that you're giving, we'll be able to see it in person versus online. But yeah, looking forward to those days. With that said, have a great week. Looking forward to next week. Will be our week 20 of Week in Review. So stay safe, stay diligent, and I hope you enjoy this song. I don't know. Let's see how you like it. Take care. There's something that happening here, and what it is ain't exactly clear. There's a man with a gun over there, telling me I've got to beware. I think it's time we stop. Children, what's that sound? Everybody look what's going down. There's battle lines being drawn. Nobody's right if everybody's wrong. Young people speaking their minds, getting so much resistance from behind. It's time we stop. Children, what's that sound? Everybody look what's going around. Before the heat, 1,000 people in the street, singing songs and carrying signs, mostly say hooray for our side. It's time we stop. Children, what's that sound? Everybody look what's going down. Strikes deep into your life, it will creep. It starts when you're always afraid. Step out of line, the man come and take you away. It's time to stop. Children, what's that sound? Everybody look what's going down. Stop. Children, what's that sound? Everybody look what's going down. Stop.
Daddy?
What?
Do you have one of these things that clean your ears out?
Q-tips.
Yeah, do you have any Q-tips?
I do. Let's go get some.